This time we are going to talk about consciousness and the different states of consciousness. Last time we were able to discuss sensation and perception. So if you haven't watched the lecture on that one, I suggest that you do because that is basically the foundation of what we are going to discuss in consciousness. Okay, so what is consciousness? Similar to my introduction in sensation and perception, I told you that there are different inputs from the environment. Okay, and it takes a lot of different processes to make sense of these inputs to make them into a one coherent experience. And this time what we're going to talk about is not really the transformation of the data from the environment into a meaningful experience, but rather what we're talking about today is how do we direct our attention or how do we understand consciousness so far. So consider yourself in this situation. If you are outside your house, then the following stimuli will be will be observed in the surroundings. So the bright light from the sky, and then the bright light, of course, it will send data to the visual processing areas in the thalamus in the occipital cortex. And of course, you will feel the heat of the sun in your skin, and therefore it will trigger the temperature sensors, sending impulses to the thalamus, somatosensory cortex, and brainstem that are in charge of regulating body temperature. So, in other words, our coherent experience of what's happening in the here and now comes from the different input of the environment, and our brain plays a huge role in how we make sense and how we can turn these different raw data from the environment into a one coherent experience. So consciousness is the awareness of one's surrounding and of what is in one's mind at a given moment. And consciousness can change very quickly when information arrives. So, say for example, you're trying to read something, but then there was a notification in your phone or someone entered the room, then you might lose track of what you were trying to read moments before that happened. And there are it is also true that much of what we do does not require deliberate conscious thought. So there are some experiences that we are not totally conscious about, but they still find their way into our minds. Okay, so say for example, this happened to me before. I was listening to a music, to a song and playing on the radio, and I realized that that song was familiar to me. And so I did my best to identify where I heard that song just to know that I have heard it from a certain movie. Okay, so in other words, I was able to remember that experience even if I was not 100% conscious about it. Okay, consciousness is required for any mental processes that involve imagining situations, such as planning future behavior. So there are some mental processes that needs our complete attention. We need to be conscious about it. We need to direct our consciousness to it, or else we won't be able to perform these behaviors. Okay, so if there are some information that we can detect even without conscious deliberate thought, there are some tasks that require our full consciousness. Okay, so here are some theories that attempted to explain consciousness. Of course, there are a lot of possible explanations of what consciousness is from different perspectives. And this is one explanation. So according to Bors in 1997, the author said that consciousness is like a workspace wherein it's like a table where all the possible tasks that you can do are laid out on the table, and consciousness is like the spotlight that selects which of these tasks am I going to prioritize first. Okay, so this theory did a really good job in illustrating consciousness, but it did not explain the origins of consciousness because that's really difficult to accomplish. Okay, and another theory states that conscious awareness occurs when neurons from many distinct brain regions work together. This is referred to as synchronization. So, one example would be if you see an apple. Okay, several areas in your brain are active, such as those responding to the shape of the apple and to the color. Okay, and where the object is in your visual field. So in this explanation, this is a biological way to conceptualize consciousness, that many areas of the brain are active at the same time. That's why there is consciousness. All right. Okay, so now how does the brain inform us that we have experiences? So one possible idea about experience is that consciousness emerges as information from seeing, hearing, and problem solving, remembering is linked with our internal states, such as emotions. So say for example, an experience is seeing something and then feeling excited for what you have seen, or hearing something and being anxious about what you have heard, and solving a certain problem and giving you a sense of accomplishment after solving that certain problem. So that is what experience is. It's the connection, basically sensing, perceiving, and how did we react to these experiences through our emotions, our internal states. So, in other words, because experiences are connected to our emotions, there are events or objects that form who we are. And the objects that form who we are more likely to be the objects that we are more likely to recall again in the future. Okay, now, so let's go to the specifics. I've been speaking about consciousness since the early part of this lecture, but this time let me define to you what are the two dimensions of consciousness that are similar but not the same. They are connected but they're not totally identical. There are some important distinctions between the two. So the first one is wakefulness, or the degree of alertness, reflecting whether the person is awake or asleep, and the other one is awareness, or the monitoring of information from the environment and from one's own thoughts. What makes these two different is the fact that a person can be awake but not aware or absent minded. This is true when we are in a vegetative state or during severe intoxication or drunkenness. So let's talk about the different levels of consciousness, starting from minimal consciousness to full or fully conscious. Okay, so the first one, or the lowest level of consciousness, would be coma. So when a person is in a coma, this is a state of consciousness in which the eyes are closed and the person is unresponsive and unarousable. So what differentiates a person who is in coma from a person who is simply asleep is the fact that a person who is asleep may be awakened by certain stimulus from the environment, such as a loud noise. But a person who is in a coma may not be awakened easily because he is not just unaware. Okay, he's not just asleep, he is also unaware of what's happening around him. Alright, so one possible explanation for a coma is that there might be a problem in what we call reticular activating system, which is a bundle of nerves in the brainstem. And like what I told you in the parts of the brain lecture, the brainstem plays a very, very important role in wakefulness and the transition between wakefulness and sleep. So people who are in a coma who show normal sleep patterns are more likely to regain consciousness than those who do not exhibit patterns of normal sleep. Okay, so that's for coma. And what are the other types of conditions under minimal consciousness? Let's take a look at that. The next one would be vegetative state. So maybe you have known someone or watch a character in a TV series or a movie who was in a vegetative state, which is defined as a state of minimal consciousness in which the eyes might be open, but the person is otherwise unresponsive. Okay, so this was called wakefulness without awareness. That's basically one example of being awake without being aware. Okay, so there was an experiment conducted with a young woman wherein researchers asked this young woman in a vegetative state to imagine a few things, such as walking through her house and playing tennis. And while they scanned her brain using fMRI, they were surprised by the fact that her brain showed activation in the same areas as did the brains of people who were conscious and are asked to imagine the same things. So in other words, even if there's no response coming from the individual, we can see that there are still evidences that there is ongoing brain activity that are coming from the suggestions of the researchers. So the suggestions of the researchers influence the brain activity happening in this individual. And it is surprising that even though the person is not showing goal directed observable behaviors, there was still brain activity that was related to something that she was not totally aware of. Okay, so basically the outcomes of this research allowed us to understand more about vegetative state. Okay, that they are more responsive, they are more aware than we initially thought. Next to vegetative state, there are also individuals who are considered minimally conscious. They only slightly differ with those in the vegetative state because if you're minimally conscious, you you show signs that you're capable of engaging in intentional behavior, such as visually tracking a person. So there's a possibility of some eye activities, but you cannot perform other types of goal-directed behaviors. So people who are minimally conscious have opened their eyes but show very little behavioral response to the world around them. On the other hand, those who are in a vegetative state cannot intentionally track a person with the eyes. A minimally conscious person can. Okay, so that's what differentiates these two. Okay, so in other words, compared to vegetative state, a person in minimal consciousness has a greater amount of brain activity and a greater amount of goal-directed behaviors. Okay, next, let's talk about the tip of the tongue phenomenon. If you're familiar with the theory of Sigmund Freud, you know that he also talked about the unconscious, preconscious, and consciousness. He talked about slips of the tongue. However, he had a unique understanding of the symbols behind slips of the tongue. You knowing Freud, he defines slips of the tongue as something that has something to do with sexual symbols, okay, or sexual ideas. However, that may not be the case in biological or neuropsychological research. The tip of the tongue phenomenon happens when we know a person's name and we know it, but we cannot come up with it. Okay? So the experience of knowing that we know a name is conscious, even if we cannot bring a name into awareness. So that differs with the conceptualization of Freud, who believed that this phenomenon is somehow sexual, but it may or may not be sexual in other perspectives. Other than that, one more example of moderate consciousness is dreaming. So when we are sleeping or when we are dreaming, we are moderately conscious because we may be roused by sounds that are important to us while ignoring others. So say for example, if you're sleeping, you might ignore sounds about, say, if you hear cats or dogs outside, you may ignore those sounds. But if the sounds are about an emergency, someone is calling your name or someone is shouting that there's fire, then you're more likely to be awakened by those stimuli. All right, so that is it for moderate consciousness. Then there's also what we call full consciousness that slightly differ with our day-to-day consciousness. The first example of full consciousness would be the concept of flow of Csikszentmihalyi. So, if you're familiar with the field of positive psychology, then you may also be familiar with the concept of flow. So, flow exists when we thrive in our ability to rise to the occasion of challenging tasks. So, basically, I use the term flow whenever I see someone fully engaged in what he or she is trying to do. Say, for example, my student in statistics, at first they would be easily distracted, but when they are giving their full attention to the problem that they're trying to solve, then I know that they are now in the state of flow or full consciousness. So when you are in flow, there's a tendency for you to ignore what's happening around you because you're giving your full attention to what you are trying to do. That's why time may pass quickly when you are doing these things. And the experience of flow has been linked by Csikszentmihalyi to true enjoyment of what you are doing. And flow is typically observed among athletes who are, for example, who are in the middle of their top performance, or performers, artists, singers, dancers who are performing at their best and enjoying what they are doing at the same time. And they feel as if they have the full use of their talents during this short amount of time. Okay? And there are a lot of research about flow, not just in the areas that I have already mentioned. Educational psychologists also measure the importance of flow in well-being in schools, connecting greater amounts of flow experiences to psychological and subjective well-being, also known as happiness. Other than that, I've also read a research before saying that materialism, for example, being motivated by having high grades, is a predictor of decreased happiness. And one thing that can buffer or protect you from the effects of materialism to happiness is the flow experience. So the more true enjoyment that you experience, the more that there's a higher chance for you to experience higher amounts of well-being or happiness or even psychological well-being. Okay? So flow, although it's mentioned in consciousness, sometimes it's not just about full consciousness. It's also about enjoyment or being captured fully by what you are trying to do. The next is what we call mindfulness, or the heightened awareness of the present moment, whether events in one environment or the events in your own mind. So mindfulness is very important when you are trying to make sense of what's happening around you and you're trying to relax, you're trying to understand your emotions, you're trying to reflect. Okay, and then you try to shy away from any distractions. Mindfulness is very important in understanding your emotions. It is also important in preventing a lot of psychological problems and psychological disorders. They have linked mindfulness to reductions in symptoms of different disorders. Okay, so it is advisable for you to have some alone time every now and then, for you just to be self-reflective in your alone time. And this is connected to a lot of optimal positive psychological outcomes. All right, so this is basically a summary of what we have talked about. So it's a graph showing that on x-axis it talks about wakefulness, and to the left is low wakefulness, and to the right it talks about high wakefulness, and the y-axis shows the levels of awareness, wherein the lower y-axis is for low awareness and the higher y-axis is for high awareness. That's why we place coma at the lower left side, because it is characterized by low wakefulness and low awareness. Okay? And then What about lucid dreaming? When you are lucid dreaming, yes, you are asleep, but when you dream, you feel as if you are in control. Okay, so that's an interesting phenomenon. Okay, then later we're going to talk about sleep. So when you're drowsy, you're not yet sleeping, but you feel sleepy. Okay, you're awake but not fully aware. Okay, so minimally conscious state resides here. Yes, you are awake, but there's a reduction in awareness. And the worst form of minimal consciousness before coma, there is what we call vegetative state. Of course, the worst would be coma because it's not just low awareness but also low wakefulness. Okay, so basically, people in vegetative state, they are awake, unlike those in coma, but they are not aware. Okay, and they're only capable of doing very little amount of goal directed. Of course, those who do more goal directed behaviors can be seen among those who are minimally conscious. All right, now that we are done with the dimensions of consciousness, let me talk about attention. So basically, attention is, since consciousness is characterized by different experiences, sensations, perceptions from the environment, one possible definition of attention is the limited capacity to process the information under conscious control, or in easier terms, we call it attention when you now direct your consciousness. So sometimes your teacher is speaking, but you get distracted by different things, such as an ongoing construction work. That's why it's hard to pay attention or to focus your attention because it is being divided by other distractors. So there are different types of attention. One of them would be selective attention. So when we say selective attention, that is the ability to focus awareness on specific features in the environment while ignoring others. So basically, if I ask you to listen, what I'm asking is for your selective attention to be focused on what am I trying to say. Okay? One example of an experiment done on attention, particularly selective attention, is the dichotic listening task, wherein a participant was wearing headphones and then the participant received message in one ear and another message in the other ear. And typically, the researchers presented several messages to both ears, and then they told the participant to pay attention to just one ear. That may be the left or the right. And they found out that if participants pay more attention to the right, then they recall more words that they hear from the right ear, and the same goes for the left ear. So that's one proof then that we can focus our attention and we can get more information if we focus our attention. So there is a phenomenon known as cocktail party effect. If you are in a party, you know that there are a lot of background noises, conversation from everyone in that room. However, there are some instances that when someone mentions your name, you immediately become aware. Okay, so that's a very puzzling phenomenon. So one possible explanation to this is that we tend to become more aware with stimuli that we value more. Okay, so say for example, you value something that is related to your mother. So whenever someone mentions your mother in a conversation, you become aware and then you become more responsive. If you went to a gathering of people who took different courses in college, then somebody mentioned psychology, then you suddenly become more aware because this is an emotionally important stimulus to you. That's why sometimes you get aware if someone is talking about you because yourself is important to you. Okay, so that is for cocktail party effect. Okay, now let's talk about inattentional blindness. So similar to what I was talking about when I discussed flow, when you are trying to do something that interests you, you try to selectively attend to that activity that you become blind to what's happening around you. So that's a natural phenomenon because you're trying to focus all your resources to that event or to that activity that you lose that you lose consciousness of other things. One possible explanation to that is what perceptual load model is trying to say. This model states that we do not notice potential distractors when a primary task consumes all of your attentional capacity. That's why when you are trying to answer an exam, you try not to notice anymore what other people are doing around you because it consumes all your cognitive. It consumes your energy. It it requires cognitive effort. That's why it might explain deadly errors such as not seeing a pedestrian while driving and simultaneously reading or writing a text message. Okay, and then later on we are going to talk about multitasking, which is related to this. Okay, so basically there are limitations to the extent of focusing attention. That's why we must be careful that we do not divide our attention in instances that our full attention is needed in a certain activity. If we have what we call selective attention earlier, if your selective attention has been focused for an extended period of time, then that's what you call sustained attention or your ability to maintain focus on a target or an idea for a period of time. So what we can say about sustained emotion is that they may differ according to age group. We know that children have very short attention span while you're growing up, your attention span tends to extend. Okay, that explains as to why movies for children are typically 30 minutes to 1 hour in length, while for adults, we can watch movies for 2 hours or 3 hours and do related stuff to that one that may take a huge amount of time. Okay, so not all the time if the person loses attention, it doesn't necessarily mean that the person is not interested in what you're trying to say. There may be other factors explaining lack of attention. Say for example, in the cases that I've handled in assessment of children, we discovered that one of the children that I assess actually has a very short attention span, not because he is not interested, but because he has a low intellectual capability for his age. In other words, say, for example, put yourself into his situation. If you're trying to understand something but your intellectual capabilities are not sufficient enough to understand what you're trying to study, then there's a possibility that you will lose your attention on what you are trying to study because you are no longer interested in that subject. Okay, that's why intellectual ability and sustained attention are also related constructs in psychology. Now, let's talk about multitasking. So, in multitasking, sustained attention is being compromised. Okay, so the evidence suggests that truly concurrent or parallel task performance rarely occurs. So basically, the evidences lately does not support the idea that multitasking exists. But rather, what happens is that in multitasking, we are simply switching our attention from one task to another. Okay, so maybe the term multitasking is not really the right term for it. But the fact still remains that when we switch from one task to another, our attention and our learning are being sacrificed or compromised. Okay, so that's why you need to be able to work on your schedules wisely for you to be able to identify what you are going to work on first. It is better to work on one thing than to multitask and compromise learning. Okay? So, according to these findings, multitasking is less likely to happen. It's more of switching from one task to another. Okay, so here is one possible explanation of multitasking: the threaded cognition theory, which says that there are limitations on concurrent multitasking or task switching or doing the same task at the same time. So if two tasks will require the involvement of the same resources, or let's say your vision, such as looking at the road and looking at your phone, then only one of them can progress. One of them would have to be compromised. Involvement with one more task will interfere with the other tasks that will use the same capability. Okay, so multitasking is much more like an exercise of rapid switching rather than actually performing two tasks at the same time. Okay, so now let's talk about meditation or training consciousness through meditation. So meditation practices that people use to calm the mind, stabilize concentration, focus attention, and enhance awareness of the present moment. So basically, just like what I've told you about flow experiences, which had positive psychological outcomes for the individual, we can say similar things about meditation, about having optimal psychological outcomes. So let's take a look at those outcomes. Okay, so here we go. Many forms of meditation develop what we call mindfulness, or fully conscious state of heightened awareness of the present moment. Mindfulness meditation encourages attention to details of momentary experiences. People with high scores on mindfulness questionnaires also tend to score highly on well-being and optimism. So one example of mindfulness that I learned when I was in graduate school is that our instructor told us to somehow close our eyes for a moment, pay attention to the sounds that we are hearing. Basically, it's increase awareness, and to the point that we had to pay attention to our heartbeats, that we must be conscious that our heart is beating. And then he said that that must be the level of awareness that we have when we are trying to talk to someone during therapy. Once you're able to practice full awareness of yourself during mindfulness, then that really helps. He said that you no longer have to think about what you are going to say. Okay? Instead of anticipating what you're going to say in therapy, it will be more natural. Okay? Because you are fully present at the moment. Your client really knows that you are listening 100% to what he is trying to tell you. That's why there are people who would like to train their mindfulness by going on a silent retreat for days. Okay? Next. So how does meditation affects the brain? So meditation changes brain functioning and brain structure. So there are some proofs saying that increased awareness through meditation somehow rewires our brain and involves the areas and improves the areas of the brain that is important in maintaining attention. That's why it's easier for us to maintain attention in the future. They have subjected in an experiment some people to 8 weeks of mindfulness training, and there were people with no meditation experience. And they found out that those with no meditation experience before showed significant increase in activity in the left frontal cortex measured by EEG. Okay, so other than that, MRI scans revealed thicker brain tissue in the areas of the cortex associated with attention, sensitivity to bodily sensations, and processing of external sensations. Okay, so those are the benefits of meditation from the biopsychological standpoint. Now that we are done with consciousness and wakefulness and awareness, let's talk about an altered state of consciousness, which is sleeping. All right, so sleeping serves a lot of function in the human body. It is not just for rest, but it has other functions like we are going to learn in this lecture. And we're also going to talk about some of the factors that affect our desire to sleep and rest, and what are the possible factors that may hinder the restorative functions of sleep. Okay, so sleeping, let's talk about this. Through a time of rest, sleep is in fact a very active process. So contrary to what you know so far about sleep, that when we are sleeping, our brains or brain functioning are very passive. Actually, even when we are sleeping, the brain is very active. Okay, and you will learn more about this as we go along. The sleeping brain is very active, but it is only partially processing information from the outside world. Okay, so it means that most of the processing that happens, it has very low input from the outside world. It mostly processes things that are already encoded in the brain. Okay, so sleep has two properties. It creates a perceptual wall between conscious mind and the outside world, and sleeping state can be reversed in an instant by waking. Okay, so let's talk more about sleep. Let's discuss the circadian rhythm. So we have a circadian rhythm, or the variation in physiological processes that cycle within approximately 24-hour period. Okay? Many physiological systems, including sleep-wake cycle, feeding, hormone production, and cellular regeneration, vary on a circadian basis. So in other words, the circadian rhythm does not only help you determine when you are going to sleep, but rather it also serves as a guideline or as a time frame in a lot of different biological functions. See, for example, our temperature varies throughout the day and hormones, etc. Okay? And then the body has an internal timekeeper, okay, that helps the circadian rhythm, and this internal timekeeper is in the hypothalamus, and this is called the suprachiasmatic nucleus. Okay, so that's our internal timekeeper. Now, when the retina in the eye senses light in the morning, it stimulates the suprachiasmatic nucleus, which in turn signals the nearby pineal gland to decrease the amount of melatonin it releases. So, melatonin is the hormone that makes us more likely to fall asleep. Okay, and it is secreted around 2 hours or around the time before your bedtime. Okay, that's why if you are taking medications or drugs that contain melatonin, such as those people who were prescribed melatonin as a way to ease their COVID symptoms, okay, they felt its side effect because they were getting more sleepy throughout the day. They are more drowsy. Okay, so melatonin is secreted mostly when you before your bedtime. Okay, so what happens is that when your when the retina of your eye senses that there's light in the morning, then that will be the signal that there should be a reduction in the melatonin being released. Okay, so that is the reason why it's important that you are living or sleeping in a room that can be reached by sunlight or has available sunlight, so that your body can easily be alerted by these input from the environment. Now, the downside of that one would be it may be difficult to sleep if you are working at night, because somehow our circadian rhythm is not made for this type of activity. Okay, particularly being awake at night and sleeping in the morning. And there were some research studies conducted about work schedules, and they discovered that changing work schedule is more dangerous than a fixed work schedule wherein you just have to go at work either at morning or at night. It is more dangerous to work in a schedule that frequently changes. Okay, so that's the importance of circadian rhythms. Okay, so here are some changes in the human body within our 24-hour cycle. So as you can see, when the person is awake, okay, there's a higher tendency to have a higher temperature, while this temperature decreases whenever we are asleep. And as you notice, we have more melatonin is secreted when we are asleep. Okay, there's a higher amount of melatonin whenever we are sleeping. And obviously, alertness would be higher whenever we are awake, and it drops down when we are asleep. Okay, so those are the body temperature, melatonin levels, and alertness that fluctuate on a 24-hour circadian cycle. Now let's talk about the sleeping brain. So in the 50s, Kleitman and Asarensky were studying attention among children, and they noticed that when children lost their attention and fell asleep, their eyes move rapidly under their eyelids. So they coined the term rapid eye movements. Okay, so perhaps when I ask you about rapid eye movements or REM stage of sleep, you will immediately think that this is a deep stage of sleep. However, REM is also known as paradoxical sleep among species without eye movements when they are sleeping. And the reason why it's called paradoxical sleep is the fact that it is light and deep sleep at the same time. Okay? What makes it a light sleep is the fact that the pattern of brain electrical activity during this time, as observed in EEG, is just this is similar or the same with the brain activity in the stage 1 of sleep. Okay, the only difference is that, which means that there's a lot of brain activity in the rapid eye movement stage, and we do dream a lot in the REM stage. Okay, the only difference between REM stage and stage 1 is that in stage 1 there are no rapid eye movements under the eyelid. On the other hand, what makes it a deep sleep is the fact that when you are in REM, your muscles are more relaxed compared to any other stage. Okay, so that makes it both light sleep and deep sleep at the same time. Now, at every stage of from wakefulness to sleep to deep sleep, our brains show a unique pattern of electrical activity observed through EEG. When we are awake, okay, we we exhibit what we call beta waves, which are rapid and low energy waves that occur when we are awake and alert. But as we become drowsy, okay, these waves become slower, but it has higher energy, okay, and it turns the beta waves turn into alpha waves, okay, occurring when you are awake but relaxed and drowsy. Then eventually you will fall asleep, and let's talk about that in the next few slides. We have talked about the REM sleep earlier. Now let's talk about the other stages of sleep, and they're called non-REM or NREM, and we are least likely to dream in these stages. Now, in NREM sleep, there are three stages, each marked by a unique pattern in brainwave. So, in the first stage of sleep, now it's called N1 sleep. Okay, that's the new term for stage 1. We exhibit what we call theta waves, which are slower and lower energy in comparison to alpha waves. Okay, so this is the EEG result, okay, pattern that was observed in the individual in the first stage of sleep. Now, when you are in lighter stages of sleep, it's also easier for you to hear input from the surrounding. That's why you can wake up after hearing some noise. Now, let's talk about the next stage. About 5 to 7 minutes in N1, you move to stage 2 or N2, and it is characterized by extremely fast extremely fast waves, and sometimes it shows some what we call spindles or bursts of activity. And eventually, neurologists discover that the purpose of these sleep spindles is for memory consolidation. When we say consolidation, we will talk more about this in memory, but in consolidation, consolidation happens basically when what you have learned is being encoded into what we call long-term memory. That is why they say that sleeping is very helpful when you are trying to learn something, because you do not just learn it, but you remember it and you encode it in the long-term memory. And that's what you call consolidation. And sleep spindles help a lot in consolidating memories. Then eventually after N2, you enter N3. Okay, after a short period of time, you move from N2 to N3 sleep, which initially consists of theta waves, then eventually with some higher energy delta waves. So as you can see, although you think that the person is passive when he or she is sleeping, actually the brain is very active when we are sleeping. Okay, there are still some brain processes that are happening even outside your awareness, such as consolidating memories and dreaming. Okay, there used to be a stage 4 of sleep, but it was removed in the literature because researchers were not able to see some key distinctions between stage 3 and stage 4. That's why those two are combined together into N3 or stage 3 of sleep. So shortly after entering the deepest part of N3 sleep, we start going back through N2 and then N1, and then on return to N1, our eyes begin to move rapidly and we are now in REM sleep. Okay, and we are actively dreaming. The night's first episode of REM sleep lasts for only about 8 to 10 minutes, and adults move through about 4 to 6 cycles of non-REM and REM sleep every night. And so also there are a lot of factors influencing your sleep pattern. As you grow older, you tend to sleep later, okay? And that's why work schedule and school schedule for older individuals are moved on a not so early time, unlike the school schedule for elementary students. Now, if students are still going to school early, for example, high school students, although they're sleeping late, these might have some negative outcomes when it comes to academic performance. Okay, there were some connections found between academics and lack of sleep. Okay, so now let's talk about functions of sleep. So sleep help with metabolic cleanup in the brain, restoring neural growth, consolidating memories, producing enzymes that protect against cellular damage. So you will not be able to get these different benefits of sleeping if you are sleep deprived. So sleep deprivation inhibits the growth of new neurons and impairs the production of chemicals that make up the myelin sheath. And if you remember our discussion in the structure of the nervous system, the myelin sheath is very, very important in conduction of neural impulses. Earlier, I told you that sleeping really helps in memory consolidation. This time, let's look at a concrete example how sleep helps learning and memory. So, there was this one study wherein they made young and elderly adults engage in a mirror learning task like the one you can see on the screen, and they identified that they tend to perform better if they learn the mirror tracing task just shortly before they sleep, okay, than if they learn it in the morning. So you may be tempted to think that perhaps studying at late night will help me learn more than studying in the morning. However, that's not always the case, because it's not just the length of sleep that matters, but also the time of sleep. Okay, so what appears to be really important for learning and memory is getting the sleep at the appropriate or what we call normal place in the circadian cycle. Okay, so most people would like to say that it's okay if I sleep late because I still get 8 hours of sleep. However, it's not that beneficial for us humans if we sleep at a different time compared to our normal circadian cycle. All right, so here are some benefits of sleeping from the biopsychological standpoint. So neuroimaging studies of people learning to navigate a virtual maze show increase in the activation of hippocampus. Okay, so they found out specifically that if people sleep after this training, the brain is still active. I told you that sleep is a very active process. It's not just a passive process. So they observed the same kind of hippocampal activity even during slow wave sleep. So if you remember our discussion before, hippocampus is very important in learning and memory. Not related to our topic right now, but still more trivia about the hippocampus is that there was one study that I remember which compared the hippocampal volume of taxi drivers and bus drivers. Between the two, taxi drivers are more likely to improvise on their routes because bus drivers follow the same route every single day, right? So what they found out is that taxi drivers have greater hippocampal volume compared to bus drivers because that's the product of challenging your brain, resulting to growth in that area, meaning that it will be more efficient for you to learn that task again in the future. Other than that, do not disregard the importance of napping. Okay, napping improves memory for language. It is interesting that a group with language learning challenges, even those with dyslexia, often have disturbed sleep patterns. So they were able to establish connection between sleep difficulties and language difficulties. So that's why it's important for you to sleep, to rest, and to nap regardless of your age because it has a lot of benefits. It's not just for resting. So earlier we talked about sleep deprivation. Now let's talk about sleep depth. So perhaps you have noticed that if you wake up early on the weekdays, you will wake up late on weekends. That's not just because of laziness, but rather it has a biological explanation, which is sleep depth. So in other words, sleep depth. Here's one example. If you get 2 hours less sleep in one night, then you owe your body 2 hours additional sleep the next night or within a few days. So, but if your schedule is so tight that you cannot pay your sleep debt, most people will not be able to pay it back. So they pay in other ways, such as drowsiness, using stimulants, lack of focus attention, or impaired learning and memory. So here are some tips to get better sleep, like going to bed and getting up at the same time each day, avoiding caffeine, nicotine beer, 4 to 6 hours before bedtime, not exercising 2 hours before bedtime, not eating large meals 2 hours before bedtime, not napping later than 3 p.m., and then sleeping in a dark, quiet room. I think that I've already explained the role of melatonin to you. And if you cannot sleep within the first 20 minutes, you may get up and do something else. And wind down 30 minutes before bedtime by doing something relaxing, okay, and avoiding the use of electronics. So it has been proven that smartphones, tablets, laptops, and other electronics activate arousal and makes it difficult for us to sleep. And texting and other types of screen use in bed is a major cause of sleepiness and daytime drowsiness among teenagers. So scores on anxiety, depression, and paranoia also increase with sleep loss. Of course, this is correlational that if you suffer from disorders related to anxiety, depression, and paranoia, then you are less likely to get a good night sleep. Okay, and typically it's one of the symptoms of of common mental health concerns: lack of sleep or sleeping too much. Now, here are the different sleep disorders that can be found in the Diagnostic and Statistical Manual of Mental Disorders. Basically, that's our guideline as future psychologists how to diagnose different mental illnesses. The first disorder that we are going to talk about is insomnia disorder. So insomnia disorder is not just the difficulty falling asleep, it's also the difficulty of staying asleep. It's also the difficulty of being up, waking up very early. Say for example, waking up 4 a.m. even though that you slept late, and because of that you do not feel rested. So a drug treatment for insomnia, one of them would be Ambien, which increases the effects of GABA or gamma aminobutyric acid. Like what I told you in the introduction lecture to nervous system and its parts, GABA is an inhibitory neurotransmitter. In layman's term, its role is more of about relaxing you, okay, instead of activating your nervous system. That's why if you lack GABA, then you are more likely to suffer from anxiety and related concerns. So we discovered from this learning that GABA is also one of the problems in disorders of sleep. So you need to have more GABA in order for you to get rested in the case of those with insomnia disorders. Another disorder of sleep is sleepwalking, characterized by activities occurring during the NREM sleep that usually occur when one is awake, such as walking and even eating. There's also what we call sleepwalking involving sexual activities called sexsomnia. So, one possible explanation for sleepwalking is that even though the rest of the brain is asleep, the parts of the brain in charge for body movement is active or highly active. Okay? And one more thing that we can learn about sleepwalking is that it does not occur in the REM sleep, it occurs in the NREM. So, in other words, there's a very low chance that you are sleepwalking because you're acting out a dream. Okay? Because dreams are more likely to happen in the REM sleep. Now, clearing out the common misconception in sleepwalking, it's not dangerous to wake someone up who is sleepwalking, okay? And that can be helpful to them because if someone is sleepwalking, then we can also assume that he or she may be in danger of hurting himself or herself. That's why it's beneficial from time to time. Okay, it's not necessarily helpful, it's not necessarily dangerous, but it is encouraged that we wake up people who are sleepwalking. Next is what we call narcolepsy. So if you are narcoleptic, you have the tendency to experience excessive daytime sleepiness. So you suddenly become sleepy, okay, even though you get a full night's sleep, okay. And typically they also experience cataplexy, which is weakness in the facial muscles and muscles in the limbs. So they feel that they suddenly felt weak in their muscles, and most of the time they collapse and they're still awake, so that's cataplexy. And it's one of the predictors of narcolepsy, which is sudden sleepiness. Now, it's very dangerous for someone who is narcoleptic to work in high risk jobs such as construction or even driving, because you know that being sleepy while driving is very dangerous. So the treatment for narcoleptic individuals would be stimulant treatment, and one of them would be amphetamine, so that one can be more awake or alert to counteract the effects of excessive sleepiness. So if there's what we call insomnia, there's also what we call hypersomnia, wherein sleep difficulty characterized by sleeping more than 10 hours a day for 2 weeks or more, which sometimes includes an urge to nap during inappropriate times. The distinction between normal sleepiness and hypersomnia is that People without hypersomnia feel rested and refreshed after sleeping, but those who are suffering from hypersomnia feel that they are so tired even after a long sleep. Okay, then after that, we have what we call night terror. So, someone is experiencing night terror, which is a state that occurs when a person walks around, speaks incoherently, and ultimately awakens terrified from sleep. So, one of the findings about night terrors is that night terrors are not nightmares, which are typical dreams with a frightening plot. Okay, so they are not nightmares. Okay, so there's also we need more research for us to understand more about the etiology, the explanations for night terrors. Now let's move away from the disorders of sleep. Let's talk about dreams. So there are different possible explanations of the meaning of dreams, but my personal take on this is that dreams are more likely to be random activity in the nervous system. For me, they don't really mean anything. Okay, but some theories in psychology would like to disagree with that perspective. You will know about those later on. And now, so dreams are defined as images, thoughts, and feelings experienced during sleep. And there are times when you are lucid dreaming or you feel as if you are actively controlling yourself in a dream. So when people in sleep labs are awakened, they report that they dream almost always if they are in the REM sleep and somewhat regularly if they were in the NREM sleep. So the stage of sleep matters as well in the contents of dreams and the plot of the dreams that we experience. So one possible interpretation was offered by Sigmund Freud, defining dreams as the royal road to the unconscious. He believes that dreams have a sexual is a sexual symbol or it has an origin that is something sexual. So he believes that dreams have two levels, manifest and latent content. So when we say manifest content, these are dream contents that are on the surface, basically what you recall. Say, for example, you dream about elongated objects or let's say vegetables like or things, personal things. That's the manifest content. That's what you remembered. The latent content of the dream would be Freud would say that elongated objects may have something to do with the male genitalia because of the shape of the object. It is elongated. Well, that's the interpretation of Freud. So basically what Freud is saying is that dreams are wish fulfillments, meaning if you dream of something, it's basically a fulfillment of what cannot be achieved or what does not happen in your day-to-day lives. Okay, so that's for the manifest and latent content of the psychoanalytic interpretation. Next, let's talk about the biological interpretation of dreams. So one of the theories that explains dreams from a biological standpoint is the aim theory. So aim is defined as activation, input, and mode. Later, I'm going to show you the illustration. So activation is a continuum ranging from low to high activation. Input talks about whether the input is internal or external, and mode talks about it's a continuum from logical when we are awake to loosely illogical when we are dreaming. So let's take a look at this illustration in the next slide. So according to this illustration, based on the definition that I offered to you earlier, okay, so waking is here on the right side because it is highly active, okay? It is at the back because most of the input are external instead of internal, and it's on the top because it is highly logical. Okay, next let's talk about NREM. So NREM is moderately active, that's why it's in the middle. It is still at the back because the input can be external and it's still logical. On the other hand, REM is here on the lower right side because like what I told you, it's a highly active stage, but the input is highly internal and the mode is mostly loose or illogical. Therefore, it's the in the lower front right portion of the cube. Okay, so let's take a look at coma here. So if you're in a coma, there is low activation, low input, and the mode is highly illogical or loose. Okay, now that we were able to talk about consciousness, awareness, alertness, wakefulness, and sleep, now let's talk about deliberate ways to alter consciousness through drugs or substances. Okay, so let's define some important terms first. First, a psychoactive drug or naturally occurring or synthesized substances, meaning it can be made in a laboratory or it can be naturally occurring that when ingested or otherwise taken into the body, they produce qualitative feelings of changes in conscious experience. Okay, so sometimes you feel that you are more alert, that your heartbeat is going faster, that you're more awake. Okay, and when you use substances a lot, then your body will somehow adapt to the effects of these substances. That's why you will need to take greater amount of that certain substance for it to affect you the same way that you were affected during the first time that you have taken that substance. That is the concept known as tolerance. So addiction is not just about difficulty in controlling yourself, but rather there are other factors here like tolerance and withdrawal. So when you develop tolerance to a certain substance, there is a need to consume increasing amount of a drug to get the desired effect. That's why those who develop tolerance towards sleeping pills may need to take more of that pill with their doctor's prescription for them to get the same effect. And there are also people who suffer from withdrawal symptoms. Those who have decided that they are no longer going to take that drug will experience some sort of a side effect. So withdrawal symptoms are the adverse effects people with physical dependence experience if they stop using a drug. For example, if you take a certain drug that makes you feel happy or alert, the moment that you stop taking that drug for a span of time, you will start feeling adverse effects such as sadness or drowsiness. That's why you feel as if you need to take the drug again for you to erase those adverse effects. Okay, that's why it's a cycle, okay, that makes you more likely to take drugs again. And sometimes drugs do not only change your alertness, they also affect your perception because some people experience hallucination. When there are hallucinations are convincing sensory experiences that occur in the absence of external stimulus. See, for example, you're seeing someone although you're alone in a room. You're hearing something although nothing has produced that certain sound. Okay, you believe that someone is right in front of you talking to you, or you believe that people look like dogs. Okay, that's well, the difference of hallucination from illusion is that in hallucination, you're seeing something even though there are no stimuli present. But in illusion, it's like when you look at a person, he or she looks like a dog. In illusion, there is an altered perception. Okay, there's actually a stimulus present, but your perception of that stimulus changes. Okay, now you need to clarify as a clinician or as a psychologist if the hallucination is a symptom of drug use you or if a person is experiencing hallucination even in the absence of substances. Like in the case of those with schizophrenia, they may experience hallucination even if they do not have history of drug use. That's because of other disturbances in the brain. Okay, and now let's talk about addiction. So basically addiction is a condition that results from habitual use and or physical and psychological dependence on a substance. Okay, so sometimes we use drugs for certain reasons like we want to relieve pain, or we want to be alert or awake. But the moment that you become reliant on those drugs and you use them again and again, then we can say that you have developed some physical or psychological dependence on a substance. Let's talk about the different types of drugs that can affect the nervous system. First, we have here what we call depressants. So basically what they do is that they slow or decrease the activity in the central nervous system. So in low doses, they can generally calm your body and mind, but in high doses, they can have more dangerous effects such as slowing down the heart rate and brain activity in a dangerous way. So what they do is that they increase the GABA activity in our body, and remember that we talked about GABA before. Basically, what they do is that they inhibit activity in the nervous system. So if there's a lot of GABA in your body, it means that there are a lot of functions that are being inhibited. That's why you're acting and you're thinking very slowly. And next, let's talk about alcohol. So basically, alcohol is something that is commonly consumed by the population, but if an alcohol in a large amount is consumed by a pregnant woman, this might be dangerous for the health of the child or the baby, because it is proven that alcohol destroys neurons of a developing fetus. That's why there is what we call fetal alcohol syndrome, wherein babies from mothers who consume a lot of alcohol during their pregnancy tend to develop intellectual problems, particularly lower IQs. Okay, and there are other adverse effects as well, such as low birth weight or other physical disturbances. That's why alcohol is discouraged if someone is pregnant. And be careful that you do not combine alcohol with other sedatives, because combining alcohol with a sedative can be deadly. And there are some celebrities that have been reported to have combined these two. That's why they were just found dead in their home, unfortunately. Okay, so you also need to, that's why these drugs are illegal or illicit, because people tend to use them, and if you combine them on your own, they may produce some deadly effects, or it can be lethal. All right, so that is it for depressants. Now, more about alcohol. We have here what we call blood alcohol concentration, or BAC, or the amount of alcohol in your bloodstream. Basically, the more alcohol that you consume, the more dangerous it is for your body. So the legal limit of the BAC should be 0.08 or below. Okay, so refer to the picture on the right part of the slide. So basically, the BAC limit, or the number of drinks it would be that it requires for us to reach this limit, depend also on our body weight. Okay, so if a person is 120 to 140 pounds, he or she can drink okay, three glasses of the alcohol for him or her to reach that legal limit of 0.08, while a person who is more than 200 pounds may consume 5 for for him to experience the same amount of BAC. Okay, so how did they say that 0.08 is the legal limit? Because that's the limit of, if you have more than 0.08, then it means that you are now driving while drunk. Okay, and you know that driving while drunk is very dangerous, because there would be impairments in the coordination and judgment. And the more alcohol that you consume, the more dangerous it is for you. Like for example, in the zero point 0.3 BAC, you might lose consciousness. In the zero point 0.4, you may even die, and in the zero point 0.5, some people stops breathing, and most of them die. Okay, so those are the effects of consuming a large amount of alcohol. All right, so here are the negative effects of alcohol. The more alcohol that a person consumes, the more obvious the depressant effects become, sometimes leading to blackout. So typically, people consume alcohol because they think that they are more likely to do things that they do not normally do. So they think that it gives them courage to perform different things. But actually, it's not a stimulant, it is a depressant. You only feel that you can do more things if you consume alcohol because it inhibits the part of the brain that is responsible for judgment. That's why when your judgment is impaired, then you're more likely to do things that you will not normally do. Okay, so here are the negative effects of alcohol. There may be accidents resulting to injury or death, usually caused by drunk driving, or there may be sudden deaths due to binge drinking. There may be blackouts, or in the long run, there may be increased risk of liver and throat cancer. Heavy drinking over a prolonged period of time can actually shrink certain parts of the brain, like frontal lobe, and your planning, abstract thinking, reasoning will be greatly affected. Your hippocampus, meaning your learning and memory, will be affected. There may also be effects in hunger, thirst, and sexual motivation, as well as cerebellum, because you know that consumption of alcohol affects body movement and coordination. So how do we define binge drinking? So basically binge drinking is defined as consuming at least 5 drinks for men and 4 for women over a 2-hour period. So mild to moderate alcohol intake generally defined as no more than 2 drinks a day. So that's how you can say that you are just consuming mild to moderate amount. No more than 2 drinks per day. All right, now let's talk about other depressants such as sedatives. So when we say sedatives, these are drugs that basically create a feeling of stupor, or stupor happens when you move very, very slow. And basically that's similar to alcohol intoxication. And here are the evidences that someone has taken a sedative. So slower heart rate, relaxed skeletal muscles, and tranquilizes the mind. So barbiturates are used in as anesthesia to calm people down. Okay, so in other words, depressants are also used for medical purposes, but some people are addicted to depressants that they take it without doctor's prescription. Okay, now let's talk about opioids or narcotics. So these can be derived from natural sources such as morphine, and some of them may be partly synthetic or lab made, such as heroin. Now, what they do is similar to other depressants. They basically slow down the nervous system, and its basic function is as a reliever of pain or pain relievers. So here are some examples: opium, morphine, heroin. They produce feelings of overwhelming bliss, euphoria, or extreme happiness and bodily relaxation. So basically, other than being pain reliever, they also give you feelings of happiness, okay, or euphoria. That's why some people may be addicted to narcotics, taking it even without doctor's prescription or using it illicitly. Now, let's talk about stimulants. So basically, stimulants hastens or activates the nervous system. So the most used stimulant in the world will be caffeine. Okay, the world's most commonly consumed psychoactive drug. Okay, as you know it, it increases your alertness, increases heart rate, and there are some other effects in the nervous system. Nicotine, okay, found in cigarette, okay, it enters the bloodstream immediately within 8 seconds of inhalation, and it reaches the brain. So nicotine is next to caffeine when it comes to being commonly consumed. And one of the illicit drugs under stimulants would be cocaine. So when cocaine is also considered a stimulant, so when snorted, it increases heart rate and produces a short-lived but intense feelings or rush of euphoria. That's why cocaine is can be addictive to those who use it. Other types of stimulants include amphetamines. So amphetamines are synthetically produced or lab made. Okay, and they produce long-lasting excitation of the sympathetic nervous system. Okay, so other short-term effects may include insomnia, stomach distress, headaches, decreased libido, and difficulty concentrating. And some long-term effects of amphetamines would be severe depression, paranoia, loss of control over one's behavior, and even psychosis. Psychosis includes hallucination and delusion. So hallucination includes seeing, hearing, or feeling something in the absence of changes in the environment, while delusions are beliefs that lack foundation. So delusions are beliefs that even though you present contrary evidences to those beliefs, it is hard for a person with delusion to change his or her beliefs. Other than that, we also have MDMA or ecstasy, commonly known as ecstasy. So it produces effects as both as a stimulant, as a mild hallucinogen. So it's commonly known as a love drug. Now, since we already mentioned hallucinogens, let's talk about them. So basically, they distort perceptions of reality, ranging from mild to extreme distortions. So one of them would be marijuana or cannabis sativa. Okay, it comes from the cannabis sativa plant. So what it does is that it alters mood and creates euphoria, changes perception, especially perception of time and food. It Other effects include increased risk for lung cancer, and it may possibly lead to schizophrenia. And we have some naturally occurring marijuana-like substances actually in our body called endocannabinoids. Just take note that marijuana can be used in medical purposes, okay? So in the treatment of illnesses like Alzheimer's disease. Of course, this is performed under the supervision of a physician, of an expert. Other hallucinogen includes LSD or lysergic acid diethylamide 25, known as acid. So what it does is that it alters visual perception, enhance color perception, hallucination, and other synesthesia. So remember synesthesia earlier. So basically LSD is the one responsible for that. When people report that they see sounds and hear visual images, when what's supposed to happen is for you to see visual images and to hear sound. So basically these functions overlap with each other during synesthesia. So basically, that is our discussion for consciousness, sleep, dreaming, and the drugs that alter consciousness. I hope that you were able to pick up a lot from this discussion.